All right, it is 9:08, time to hide your kids. Chrissy Russo is standing by with the good doctor to talk about some grown-up things this morning, right, Chrissy?
Should I leave too?
Maybe.
Totally good advice. It might be a good idea to get the kids out of the room right now. I don't usually say that, but I kind of mean it this time because we're going to be using some terminology that might be a little advanced for them. So we're talking about a brand new study that is groundbreaking, huge news. Approximately 4 out of every 5 women in the United States have used birth control pills, and Dr. Irwin Goldstein from San Diego Sexual Medicine Alvarado Hospital is here to explain how hormonal contraceptives may be doing more than just providing birth control. What did they find?
So, Chrissy, thank you for always doing these things. I appreciate it.
You know I love it. Thanks for being here.
So, 4 to 5 women is roughly around 80 million women have been exposed to birth control pills.
Americans.
Americans.
Anytime. Like, even if you took them for a month or 10 months or 10 years.
But people usually use them for longer than a month, but
okay.
Whatever. So, birth control pills are fabulous. They're easy to use. They provide very high rates of contraception, and they do their job, and they prevent teen pregnancy. And life would be good, except there's no appropriate exposure to users of risks. So birth control pills in about 12% of women, so that's roughly 10 million American women, are going to have lots of pain when they have sexual activity. And it's been a mystery, sort of why the 10 million are sort of, who are these people?
Why they're experiencing pain
why they're
and why
experiencing
others
and the rest of the 70 million women are not.
Is that what this study just showed?
So we said we have to understand this because we have to better advise our users of birth control pills.
Sure.
So we took women who had the pain and we took blood samples from them, and we measured what's called the integrity of their receptor. So there's you have a hormone called testosterone.
Receptors, or just any receptor?
Yeah. So we looked at testosterone. We know one of the non-mysteries and non-controversial issues about birth control pills is every user, so all 80 million women, will have a lower testosterone value for using the birth control pill.
What?
Yes, so every...
So is this is, now do we know, I'm sorry for interrupting, doctor, but is this do we know this is a causation, or do we know this is a correlation?
So we have some hypotheses working. We do know 100% of all users of birth control pills will have low testosterone.
Statistically, that's almost...
That's not statistics. It's
impossible.
It's what the birth control pill does.
What?
Well, you know, birth control pills protect acne. They do protect acne because they lower testosterone.
Interesting.
So the way it does that is there's a protein in the liver, okay, and it binds the testosterone. So when you take the pill, that protein gets secreted at very high rates. So you bind the testosterone.
Okay, but what does that mean for a woman to have lower testosterone, though? Because I think a lot of people don't understand that women have testosterone, a lot of it, and need it.
So, yes, testosterone is important for desire, etc. But still the mystery happens. Since 100% of users have low testosterone, why is it that these 10 million are getting pain? So we took blood from those women who have the pain, and we took blood from those women who were on birth control pills but didn't have the pain. Okay, and I'm just going to show you, first of all...
Okay, this is interesting.
This was published in the Journal of Sexual Medicine, which is our fabulous journal.
Yes.
That comes from San Diego. So this is, I'm going to make this up here. This is the testosterone molecule. Okay. And this is a cup, but in essence, physically, the testosterone has to fit into a receptor to make everything work. Okay. So normally, women have a great receptor, and even if they have low amounts of testosterone, because it's a great receptor, they're not challenged by the low testosterone.
Right.
Okay. Now you introduce...
Because at least it's just lower, not lowest.
Correct.
Okay.
And introduce now a abnormal receptor where the testosterone doesn't fit very well.
So anything that's there, even though it's low that's there, still not being communicated with the rest of the body because the receptor's not working.
Yeah, so we found in those 12% of women, they have an abnormal receptor for testosterone. So that's fabulous information.
Would you recommend not using the pill?
Well, I'm not a great birth control pill fan because it fools around with hormones, and I'm a big hormone, sex and hormones are strongly related. But a lot of people do use the pill. So maybe perhaps this research will lead to genetic testing. So a woman is considering taking the pill, she'll take a blood test to see if she has these abnormal receptors. Then we'd be advised to not use that. But if a woman is out there who's having pain during sexual activity and that's distracting and bothersome and affecting the relationship and the pleasure and satisfaction, well, you have to consider getting off your birth control pill.
What can you do instead, though?
So Intrauterine device is a mechanical way to do this. I mean, diaphragms and condoms are also mechanical, but an IUD is perhaps more popular. It's a metal copper that's carefully engineered and placed within the uterus, so it's done with a procedure. It stays there for 5 years. You don't take a pill every day of your life at the same time every day.
The one thing I like about birth control pills is they're so easily accessible to everyone, every economic group. You know, you can go, basically they're handing them out at Planned Parenthood or clinics and that kind of thing. Or is the IUD as easily accessible?
Go back to Planned Parenthood. Planned Parenthood puts IUDs in women.
Okay.
And honestly, it's called LARC, L-A-R-C, long-acting reversible contraceptive. It's far better than the birth control pill.
This is great news. Dr. Goldstein, I think women have known for a long time that there's something else going on with those birth control pills.
There are.
And thank you for all the research you do for women, because, you know, not of all, the whole medical community, you know, doesn't focus on women like you do. And so we appreciate that. Good work. Anything else before we let you go? I don't know if we hit all your talking points that you needed to get, because this is important stuff for me.
Happy October.
Right?
Enjoy the fall and enjoy a great sex life.
Yeah, I like it. So, Dr. Goldstein, spreading goodwill. Thank you for being here. If you want more information on where you can talk to Dr. Goldstein, go to our website, foxeyesandiego.com. Get his information and get in touch with him if you need to. Guys, that wraps it up for us. I'm going to send it back over with you.
It's like a perfect card, perfect greeting for the holiday season. Have a great October. That's, yes.
I like it. God forbid there's more love in this world, right, y'all?
Yes, indeed. Are the kids back in the room now? Can I come back in the room?
Everybody can come back.
Thank you both.
It's safe.
Yes.